In this video, you will be able to explore about signs and symptoms, diagnosis, and treatment. Let's begin with the signs and symptoms of amyloidosis. Kidney damage results in swelling in the face, ankle, and legs. Intestinal damage leads to malabsorption and weight loss. Heart damage can cause palpitations. Brain suffers from memory loss in case of Alzheimer's disease. Enlarged tongue is an issue in some cases, which results in speech problem, interference with swallowing, and nasty breathing, usually at night. Liver becomes enlarged, resulting in hepatomegaly. Lungs suffer from shortness of breath. Nerve damage leads to numbness and orthostatic hypotension. Now we will be heading towards the diagnosis of amyloidosis. The simplest method to get a sample is aspirate fat from abdomen, which is then further tested. A road to diagnosis is Congo red stain. Sample is then dyed with this stain, and amyloids turn pink with this stain. Amyloids, when observed under polarized light, they take on apple green color. Both Congo red stain and polarized light can detect 70 to 80% cases of amyloids. Biopsy is another option, which is performed by taking a small sample from living tissue and examining it under a microscope. It is done when above-mentioned tests appear negative, but condition of patient still predicts the presence of amyloidosis. After confirmation of amyloidosis, it is necessary to find out the type of amyloid, which is done through laser microdissection of Congo red stain positive samples, which are then processed by mass spectrometry. Now, let's have a glance over treatment of amyloidosis. Amyloidosis can be treated by using chemotherapy, cardiac care, and organ transplantation. There are three main approaches to disrupt amyloids. First of all, there is a need to prevent amyloids by early and precise diagnosis, and then treatment with chemotherapy, RNA therapy, and organ transplantation. Second approach is to stabilize amyloids by some drugs, which maintain the normal structure of proteins by hindering their misfoldings. Third tool is to target amyloids and remove them by directly tagging them with the antibodies, so they are easily degraded by body's defense system. Our aim is to provide you all the relevant stuff in best possible way. Thank you and stay tuned on sqadia.com.